Rachel Cohn. I'm an assistant professor of medicine and core faculty in the Palliative and Advanced Illness Research Center, or PAIR Center. Today, I'm very excited to be talking about a Journal of General Internal Medicine manuscript that we recently published about the Joint Research Practices Working Group. The goal of the JRP is to identify best practices and guidelines for the practice and incorporation of equity, inclusion, and access across the arc of the research process. So from idea inception to grant writing to performing the actual research to result reporting and dissemination. And while this started as just a focus on the research practices done within PAIR and CHIBE, our goal is really to network and collaborate and to disseminate this work to the broader research community, both within Penn and externally. Prior to the initiation of our work in the JRP, we actually reached out to peer institutions to see if anyone was doing something similar. And what we found is that even in places where there's a lot of work being done surrounding health equity and social justice, there was no group who was working on identifying best practices and guidelines for the practice and incorporation of diversity, equity, inclusion, and access across the arc of the research process. One of the guidelines we've developed is participant payments and incentives. For these guidelines, we have several recommendations. These include offering various types of incentives and payments to participants, including cash payments. These also include paying participants as soon as a particular study task is completed and not delaying payment until the end of the study. We also recommend that researchers investigate any fees or delays associated with payments and communicate this promptly to participants. And finally, we recommend that researchers investigate ways to decrease costs to participants. So these include things like having study visits that are closer to participants' homes so they don't have to incur fees for transportation. We also recommend things such as providing meals to participants and potentially transportation costs, costs of childcare, and costs of elder care. Another guideline we've developed is surrounding language interpretation and translation. For these guidelines, we recommend assessing the top languages of participants in the target population for researcher studies, assessing the different touch points that participants have throughout the study. So these could include things like recruitment, consent, frequently asked questions, or a hotline to answer questions, and then investigating local resources available for interpretation and translation services. Although it's always been critical to enroll representative populations in studies, it's more important than ever at this time, given the amount of immigration in the United States, to include limited English proficiency participants within our research studies. Another thing we've done is to develop a toolkit of all the guidelines that we have published on and that we have since developed since this manuscript was published. This toolkit is available on both the PAIR and CHIBE websites under the heading of the Joint Research Practices Working Group. Another service we now offer is called PERCS Consultations. So this is providing equitable research knowledge sharing. And what this is colleagues can reach out directly to the JRP to request real-time guidance in operationalizing equitable, inclusive, and accessible research practices into their research throughout the arc of the research process. So this can be anything from idea inception to grant writing and budgetary considerations to research implementation, results writing, and dissemination. The response from clinicians and researchers, as well as other faculty, has been overwhelmingly positive. Of course, this adds in logistical barriers to implementing just equitable, inclusive research, but there's been a shift in the culture, particularly that we've noticed within the PAIR and CHIBE centers, of trying to think preemptively about how can we incorporate these elements into our study within the confines of our budgetary constraints. Overall, we've had more than 30 PERCS consultations since inception. Several of these have been from faculty members directly, and the remainder have been from staff representing faculty research teams. And again, overwhelmingly, people are really excited about having a resource to help them operationalize just and equitable research practices into their own work.